One of the most important concepts of upper cervical care is the concept of holding your correction. Now, within the profession, some people still refer to it as an adjustment, but correction is a more accurate term because that's what we're going for here. A correction that holds, not something that needs to be adjusted over and over again.
It's holding the adjustment that gets people better. It's not adjusting them. It's keeping the interference checked out over a period of time that allows people to heal and repair back to normal state of health.
I talk about holding is healing. When you're holding your adjustment, that's when you're working at your best. Your body is able to function optimally. Chemical insults, including medications, alcohol, smoking, stress, those can make it so that you don't hold your adjustments as well. They weaken the ligaments that hold the body, hold the bones together.
Each time I check a patient, I'm looking to see if that body is in a healing pattern in terms of balance. Are the muscles of the spine balanced? Is there head-neck distortion? Is there locking in the mechanics of the spine? Is there leg length discrepancy? Is there articular pillar pain or tenderness? When all of those are checking clear, that body is in a healing pattern and you need to allow it to continue to heal and only adjust when it's pulling out a pattern and needing that assistance to continue to heal.
Within 2 months, 25 different symptoms that she had were almost completely gone. She held the first correction for 6 months. That's the power of upper cervical chiropractic. It is not adjusting, it's holding. I didn't heal her. All I did was put the bone back under the body's control, cleared the neuro canal, and innate intelligence, that inborn wisdom that flows from above down, from the inside out, restored her back to health.
On each of her follow-up visits, he would help her maintain that alignment correction so there's no interference in the healing process until it was complete.